Hi, my name is Rachel Denny. I'm one of the Integrative Geriatrics and Palliative Medicine Fellows at the University of Michigan. I'm talking about the Journal Club today very briefly. The title of this journal article was Time to Benefit of Statins for Primary Prevention of Cardiovascular Events in Adults age 50 to 75. So some quick background on this. The authors wanted to stress the importance of individualizing statin decisions. They wanted to talk about the risk versus benefit of statins, and they really wanted to stress the patient heterogeneity in our geriatric population. They looked at cardiovascular risk, comorbidity burden, along with considering functional status, life expectancy, and ultimately patient goals. Their objective was to conduct a survival meta-analysis of randomized clinical trials of statins to determine the treatment time to benefit a first major adverse cardiac event, which is MACE, in adults aged 50 to 75 years. Their question was, what is the time to benefit of a statin therapy for primary prevention of cardiovascular events in adults aged 50 to 75? First, different studies that they looked at, eligibility criteria were randomized controlled trials with mean patient age of greater than 55 years. They focused on primary prevention, less than 50% of participants with known existing CAD, large trials greater than 1,000 participants, and trials that are rated high to moderate quality by Cochrane and USPSTF criteria. Their outcomes for interest was first, their primary outcome was time to first major adverse cardiac event. They had different trials with different definitions of major cardiac event. So all trials focused on myocardial infarction and cardiovascular mortality, whereas 4 trials also included revascularization, angina, and stroke. The results of this, they had 8 randomized clinical trials with 65,000 participants, size range from 1,000 to 17,000, mean age 55 to 69, anywhere from 1898 and 2010, and all studies with less than 10% of prior CAD. Patients need to be on a statin for 2.5 years to prevent 1 major cardiac event per 100 patients. 1.3 years to prevent 1 major cardiac event per 100 patients, and 0.8 years to prevent 1 major cardiac event for 500 patients. So their bottom line that they continued to bring up was it takes about 2.5 years to prevent 1 major cardiac event per 100 patients in regards to primary prevention. The study looked at, basically it's looking at adults age 50 to 75 with a life expectancy greater than 2.5 years. Their bottom line was the benefit takes years to happen, and the unfortunate potential harms of statins could only take weeks to happen. The strengths of this study were it was the first study to use quantitative methods to determine treatment to benefit time, and their average was 1.5 to 3 years. They used pool studies with analysis of treatment time and absolute risk reduction. They tailored it to patients' risks and heterogeneity. A lot of these studies had patients who were diabetic and various patients who were, there was more female patients, more male patients, and just based on age range. Another strength was that they focused on primary prevention, which is very hard to find and a very tough question in clinical practice. And it gives a date range for the patient, even though that is a lot of patients if you think about 2.5 years for 1 patient over 100 patients. Limitations again, it was age range. We're hoping for a little bit of an older age range. And they focused on, when they want to focus on older adults, with 3 of the studies only had a mean age over 65. They're limited on study inclusion based on the high rates of pre-existing CAD, so they could not include the PROSPER trial. And they only had a very small sample size of patients over 75. Bottom line is, so kind of the research evidence for statins is lack of randomized controlled trials, suboptimal risk, prediction model approaches, and then there's this practical geriatric care considerations, if statin-induced myopathy, cost effectiveness, disability, and then risk assessment as well. So bottom line from this study, 1.5 years to prevent 1 major cardiac event for 100 patients aged 50 to 75 years. This, I think, if anything, shows the importance of individualizing statin treatment and how it is a joint discussion about their patients' and values and preferences, and the need for future studies, which are hopefully coming soon, starry and preventable.